Before the governor took to the mic this afternoon, he met with community members calling for equity in distributing vaccine.
12 News reporter Brandon Truitt is live at the State House where a news conference was held this morning. He's got the details on how the governor is responding tonight. Brandon?
Hey, Mike and Shannon. So those community leaders really gathered on the steps of the State House this morning. They say the data is clear. When it comes to vaccinating people of color, they're not getting a fair shot.
Thursday morning heard calls for equity in the fight against COVID-19. Members of community, medical, and religious organizations saying people of color are being left behind.
We need to ensure that all individuals, all people of color, especially those on the front lines, have the opportunity to get the COVID vaccine.
We are going to continue to do whatever we can do with the little we have.
Data from the Rhode Island Department of Health shows the coronavirus has impacted people differently. White Rhode Islanders make up the majority of COVID deaths, but those have been mostly concentrated inside nursing homes, which were prioritized first for vaccines. People of color, meanwhile, make up about a third of the state's population, but account for 41% of positive cases and 40% of hospitalizations due to the virus. Yet state vaccine distribution data shows just 19% of doses have gone to people of color.
We're much more likely to work essential jobs and thus be at risk of being exposed to this virus.
Those who spoke today are calling for a designated mass vaccination site and designated doses. They say they can provide the transportation, they just need the space and vaccine. Governor Dan McKee saying he sees a discrepancy and wants to fix it.
There is an issue there, and wherever there's an issue, we need to really address. If, for instance, the black community is at 3% of the shots, and they're at 8% of the 8% of the population, we got to ratchet that up. I think everybody would understand that.
Dr. Nicole Alexander Scott said today, point blank, more has got to be done to fix the discrepancy. At this point, it's unclear what a mass vaccination site that's designated for people of color would look like or when one could ultimately open. Live in Providence, Brandon Truitt, 12 News.
We've seen the pandemic hit communities of color especially hard, but leaders of those communities say the vaccine rollout is leaving them behind.
They gathered at the State House today before the governor spoke with a message. 12 News reporter Brandon Truitt continues our in-depth coverage with what they're asking for and the governor's response.
Those who spoke today were from community, medical, and religious organizations. They say the data is clear. People of color are not getting a fair shot at a vaccine.
Therefore, the issue is not hesitancy, it's access. We want access.
Calls rang out Thursday morning on the steps of the State House.
For us, people of color, receiving the vaccination and the vaccination process is slow, cumbersome, and difficult.
Data from the Rhode Island Department of Health shows the coronavirus has not impacted everyone the same. White Rhode Islanders make up the majority of COVID deaths, but those have been mostly concentrated inside nursing homes, which were prioritized first for vaccines. People of color, meanwhile, make up about a third of the state's population, but account for 41% of positive cases and 40% of hospitalizations. Yet state vaccine distribution data shows us just 19% of the doses given out so far have gone to people of color.
It's people having a sense of hopelessness that they're not going to have a chance to have the vaccine in the first place.
This group is calling for a mass vaccination site or designated doses specifically for people of color. Governor Dan McKee saying he hears the calls for more equity.
If, for instance, the black community is at 3% of the shots, and they're at 8% of the 8% of the population, we got to ratchet that up. I think everybody would understand that.
Leaders here saying they plan to help pull it all off.
That if we need transportation hubs, we will staff them. That if we need to mount people on buses and get those buses to whatever real estate we're given, we'll do the work. Just give us the space.
And some of those who spoke today met with Governor McKee just before the briefing. At this point, it's unclear what a designated mass vaccination site would look like or when one could open. In Providence, Brandon Truitt, 12 News.